What is premature ejaculation?
I want to thank you once again for this opportunity. I would like to introduce premature ejaculation because this is a condition, just like you said, which is very prevalent, occurring in about 20 to 30% of males, all males, put together. So this is a significant number of males who experience premature ejaculation at one point or the other in their lives. However, they don't speak about it enough because of the stigma associated with, sexual performance, most especially in this part of the world where, we live in a place where the man's ego is very high, and, they don't want to be seen to be inadequate sexually in their relationships. Rather, they want to tag the woman, being promiscuous or liking too much sex, instead of facing the fact that, you can improve on your sexual performance. So the International Society for Sexual Medicine found this very important, and they made a definition for premature ejaculation. And the definition of premature ejaculation consists of 3 parts. All right. The first part is that premature ejaculation is defined as the inability of a man to delay his ejaculation. All right. And usually the second part is that it occurs before penetration, anytime before penetration, or within 1 minute of penetration. All right. And the third part of it is that the consequence of this is usually a lot of depression, self-doubt, and affects interpersonal relationships. So if you look, you're going to see that is a quite a wholesome definition. Starting with the duration of time, it talks about ejaculating before penetration or within 1 minute of penetration. It talks about inability of the man to delay ejaculation. And the final part is the consequence based on the man's psyche and affectation of relationships. People have been known to be suicidal, if you know what I mean, as for those, especially those who have this kind of condition. So I want to go further, since you've given me some time, to talk about the fact that there are different types of premature ejaculation. Some people, are born with, this condition. What I mean is that from the first experience of sexual intercourse, they have premature ejaculation up until the last. It's always there. It's always been there. This is what you see in people who have some background genetic abnormalities or hormonal issues, people who have some, hormone imbalances, and other forms of sexual dysfunction. In this kind of people, you see that the premature ejaculation occurs alongside other forms of male sexual dysfunction, like erectile dysfunction, other forms of ejaculatory dysfunction and stuff like that. Okay, it can be secondary in a circumstance whereby this individual has actually had normal sexual intercourse in the past, but more recently has developed, this kind of condition. So you see this in people who have, some prostatism, thyroid-related disease and stuff like that. Okay, and then there are other subclassifications like the variable type, which means that it doesn't occur all the time, intermittently. You may have normal sexual intercourse today, and then sometime, sometimes it's normal, sometimes it's premature ejaculation, if you know what I mean. So I'm just trying to let you know that a lot has been done on this topic. There are, a lot of knowledge, has been explored on this topic. And it tells you that if people have studied something and people know the pathophysiology of something, it means that we have an idea of how to go about treating this condition and improving men's, sexual performance.
Now, I want to go further, sir. And people are wondering, what are the causes? Is this common young men than the elderly? Is there a specific, what are the risk factors? What are those things that we can do that would make a young man come down with premature ejaculation?
So like I said earlier, it is very common. It's actually more common than you think. as this occurs in 20 to 30% of men. Okay, so it's very common. And if you practice, urology like I do, then you see a lot of people coming to the consulting rooms because of these problems, especially those who have partners, that are understanding enough, and bring them, because most men wouldn't want to come. They may come and give you some other flimsy reason why they came, but along the line, they will now tell you that, doctor, is like, I'm not. They may say it when they're even going. That's the funny thing. And you ask them, guy, if you have a problem, come straight. Don't come from the side. Come straight. Let's handle your problem. When it's going, doctor, it'd be like say, and stuff like that. But we understand. We understand that this is a very delicate topic. We understand the emotions that are attached to discussing such topics. And the idea is to make men comfortable enough to realize that it's not anything new. It's something that we know, that we see all the time, and it's something that we can help. Yeah. So when when we counsel in that way, then people come forward and are able to talk about it. So it's very common in young men, okay? Very common in all age groups of men, but we see a lot in young men. The truth is that younger men are more sexually active. Younger men are more adventurous. They are the ones that want to, they have the appetite for a lot of sex and libido. So it's in this age group usually that this complaint, comes about. And don't forget that we live in a time where women are now a lot more exposed, and a lot more vocal, so the young women of our generation can tell you that young man, you're not performing well sexually. I'm used to this kind of thing, and so it's become something that we are beginning to see a lot more, because partners are now interested. They are talking about it. So this communication is what we want to encourage. All right. So as I mentioned earlier, there are some disease conditions that can be associated with erectile dysfunction, with premature ejaculation. I mentioned the fact that there could be the primary type, in people, as I said, people who have it from onset, from their first sexual experience. It has always been premature ejaculation. And this happens in people with hormonal imbalances, as I mentioned, people who have some form of it's associated with other forms of male sexual dysfunction. So men in this category have a different form of way to go about their treatment. Then it can be a secondary type, it can be in a man who has normally had normal sexual experience and develops it. So usually as a man gets older and develops some prostate-related diseases, this can occur. Thyroid-related diseases can also occur, something like that. All right. So so there are various conditions that can, like comorbidities, if you know what I mean. There are other medical conditions that can coexist or cause a man to have this kind of present with premature ejaculation. Before we go further, so let me just say something very important here. I know you didn't ask this, but this is important for the viewers. I hope there are people listening actually, because I think they will benefit from this. When it comes to the pathophysiology, because we've asked ourselves, why does this occur? Okay, so what it took us to go inwards and think about what leads to ejaculation in the first place. And we know that it's a complex, interplay between the brain, the spinal cord, the nerves that supply the penis, okay, and all these things. So what happens is that when during intercourse, there's a lot going on. Apart from the thrusting in and out, there's a lot of emotion, there's a lot of release of several, agents like serotonin and co in the brain, stimulation of the spinal cord. Ejaculation itself is captured by the sympathetic, mechanism. So one of the most important pathophysiologic mechanisms of premature ejaculation is the fact that there is an increased or heightened sensitivity in these individuals, in the corona. The part of the penis, the cap of the penis there, is rich in nerve endings. There's a lot of nerve endings there. So in these people that have these conditions, there is increased sensitivity. They are so excited, So it heightens the sexual pleasure to the point that, they can't control ejaculation. Okay, so this is there are many other things I'm saying, but I'm trying to say what the people will understand very easily. So it's like the thing is sweeting the person too much, because the nerves are there's a heightened sensitivity of those nerves, almost like a hypersensitivity, and this is what lets them to ejaculate a lot faster. So what we say is that their latency time is very short. The time between they have the erection and when they is such a short time. So I hope this is important, because many of the ways we go about treating are aimed at reversing or delaying or slowing down the sensitivity, if you know what I mean, so that the man can have the erection for a longer period and be able to give the partner a lot more pleasure during the period before ejaculation.
So I'll allow Dr. Israel, my co-host, take over. Dr. Israel.
Thank you so much. And Chief Sir, please, can you in a little way tell us what will someone be feeling when we say, premature ejaculation? How long will somebody be having a sex before you ejaculate, before you will now say, okay, this is premature ejaculation? What time limit are we going to take to say, yes, this is premature ejaculation? That was one. And please, can you give us some signs and symptoms that the persons can have, risk factors that will make us to know that, yes, okay, risk factors that will be among the causes, but signs and symptoms that somebody can present with and tell you that that, yes, this is really premature ejaculation.
Oh, okay. So I'll start with the first thing you asked. The first thing you asked. Sorry, what was the first thing you asked?
Okay, the first thing I asked is there a time?
Okay.
A time.
Yeah. Okay. Yeah. So
yes.
So I'll start by talking about what is normal duration for or latency time between the time of one has an erection, penetration, and ejaculation. So studies have been done in populations all over the world, especially in Caucasian populations, and it's been found that the average latency time for men is between 5 to 7 minutes. All right, between 5 to 7 minutes. 70% of men will fall into this category. Okay, so when we talk of premature ejaculation, as I mentioned earlier before you came in, it's ejaculation that occurs before penetration or within 1 minute of penetration. But I also like to add at this point that the other component to it is inability to delay ejaculation. And the third part, the psychosocial components or consequence of this. Okay, I've discussed this earlier. So why we say this is that your 3 minutes may be premature for your partner. Your 4 minutes may not be okay. So this is why it's not particularly only tied to the time duration. There's also a component that says inability to delay ejaculation. So if your partner wants you to for 10 minutes, then it's expected that you're able to regulate it enough to give her the pleasure that she. I was just trying to say that I was trying to marry the time and let you know that it's not just about the time. Okay, and then this now brings me to your next question: signs and symptoms. This one, there's no sign and symptom or anything. It's very clear. It's even the uneducated man knows. Doctor, I know the last. So as I enter like this, I don't pour. And even their spouses or their partners will tell them, "Oh boy, this thing no the last." It be like say it be 1 minute man. It be like saying 2 minutes, na Indomie noodles and stuff like that. A lot of derogatory terminologies and stuff like that. And so this is also part of it. This is also part of the psychosocial component, because it causes a lot of loss of confidence. The person, looks down on themselves. It causes a lot of breakups in marriages and relationships. And as I mentioned earlier, we've seen cases of suicidal tendency among men who have this kind of condition. So it's so important, to have this kind of session so that we also let the women know that, part of the treatment also involves being there for that person and for you guys to seek help, seek care together, because the partner also determines a lot in the success of this, of some of the interventions that we offer. It's something that is better done as a team, So
the next thing I want to ask is, can it be treated? If yes, is it based on medications only, or surgery?
Okay, so this is very important. You know, as you said earlier, there are a lot of charlatans. There are a lot of people online marketing all sorts of things, you know, alcoholic beverages, all sorts of stuff, you know, that people should come and take. Are you a 2-minute man? Take this, take that. Sadly, you know, because of lack of knowledge and lack of, you know, exposure, people fall prey to some of these things. Take a lot of alcoholic herbal beverages, end up frying their livers, end up damaging their kidneys because of, you know, premature ejaculation, rather than meeting the experts who will lead them through safe, you know, treatment. So yes, there is treatment for erectile dysfunction, all right, and the treatment is premature ejaculation, and the treatment is a combination of behavioral modifications or behavioral therapies and pharmacological therapy. So what in layman's terms, it means there are certain ways that, you know, we can discuss and teach you how to modify sexual intercourse in order to last a lot longer. And at the same time, there are also medications or drugs that can be given that can help, you know, to make you last a lot longer and help you and your partner to achieve better sexual experience. Okay, so in my clinics, I usually emphasize much more on the behavioral therapy and the lifestyle changes, because I believe they are the mainstay of treatment. Even though I know that alone this may not suffice. In some patients, despite this, you can only get it up to a certain level until you introduce some pharmacological or some drugs, you know, to treat. So you can treat this successfully. You can improve, you know, men's sexual performance successfully. This has been done. You know, you wonder why. You see, you know, some people will tell themselves that, don't believe the things you see on TV. If you watch pornography, those people who take drugs, those things are not real, they're addicted. That's not true. This is their life, this is their job. So these are men who have learned the act of prolonging sexual intercourse, you know, and delaying their ejaculation as much as possible in order to achieve those videos that you see online. So if people can do that, then we're not saying you should be a porn star or anything, but there are ways to continue to improve and continue to prolong your latency time and improve the sexual experience for you and your partner.
Quickly, sir, can we prevent premature ejaculation? Can we prevent it? If yes, what can we do?
Well, it's difficult to say that we can prevent premature ejaculation. What I can say is that sometimes chronic masturbation can be a cause of premature ejaculation, and of course also a cause of male sexual dysfunction. Okay, so that's the kind of behavior that I would say, okay, I normally encourage or discourage young men from chronic masturbation. It's not a good thing to do, because it can affect that. Otherwise, it's difficult to say things that affect, you know. Another thing again is that certain kind of illicit drugs, excessive use of alcohol can affect ejaculation one way or the other. As I told you, ejaculation is affected by, to ejaculate, you need a complex interplay between the brain, the spinal cord, the nerves, and that supply the penis, okay, and the sensation. So usually illicit drugs, you know, starting with excessive use of alcohol and all the hard drugs like cocaine, marijuana, all the things, you know, that people smoke, can alter or affect, you know, the milieu in the body, and can also be a precipitating factor. So I would discourage people from using some of these illicit drugs and excessive use of alcohol all the time, because these are things that can also affect. Otherwise, for those who have the primary type of premature ejaculation, like we mentioned, those that from their first sexual experience, they have always had it. So such people are people who have some form of pathology, hormonal imbalance, as we mentioned. in that case, there's nothing they could have done to prevent anyways, so they have to still present to the doctor to treat as needful.
The first one is concerning exercise. Is there a relationship between exercise and premature ejaculation? Because I know someone, he said he doesn't exercise, and he was told that if he does exercise, his premature ejaculation would improve. So is there a relationship between exercise and premature ejaculation?
Oh, there is exercise is very important in male sexual health. When you exercise, you are fit. I mean, let's start with the dynamic exercises like jogging, brisk walking, swimming. These work on all parts of the body, all the muscles. It also works on the heart. And this is important for blood flow to every part of the body, including the penis. So it encourages good blood flow to the penis and stronger erections. Number two, when you do exercises like weightlifting, benching and things like that, that develops your muscles. Sit-ups and co develop your abs, your back, work on your back and all that. These ones also naturally increase the blood testosterone level. Testosterone is the hormone that makes us men, that gives us good erections, healthy libido, etc. So you can see all the benefits. Let's go again and say that the stamina to have sex is also improved when you are fit. When you have strong muscles, you can keep thrusting, you don't get fatigued, or like some person who is not fit. 1 or 2 stars, he's tired, he's panting, he can't go. So fitness for sex. And then directly to the question that was asked, part of the modalities of treatment, or one of the behavioral things that we ask is improvement in Kegel exercises. The pelvic floor is important in controlling ejaculation. All right. So there are various types of exercises that help to strengthen the pelvic floor, including what we call Kegel exercises. Kegel exercise. So this is in itself is one of the modalities that can help us in treating premature ejaculation. When you have good Kegel techniques to help to tighten the external sphincter, that can delay ejaculation and therefore prolong sexual experience and reverse premature ejaculation.
Questions are pouring in. So I have one on the screen here. I have to pin it. Please, doctor, does premature ejaculation have anything to do with age and stress?
Oh, certainly. Age, I can say that age is not really a big factor because as we mentioned, there are different types of premature ejaculation. There are young men who have had it all their lives. And of course, there are also people who have the secondary type who may have had normal sexual experience in the past and then develop it in the future. So all age groups can be affected. Stress, yes. When the mind is stressed, just like you mentioned, there is a complex interplay between the brain, the erotic part of the brain that enjoys sexual intercourse, releases hormones like serotonin, etc., the spinal cord and the nerves, and penis and ejaculation. Okay, so when the brain is stressed, okay, this can be something that can lead to premature ejaculation, and especially the secondary type. So what you discover is that in a different, so when the brain is stressed, just like we were saying, yes, it can be a cause, but on a different day, after getting enough rest, different partner, whatever it is, you discover that it's no longer there. Okay, so yes, certainly stressful factors can predispose.
We have another question here that says, thank you so much, Doc. What's the difference between premature ejaculation and erectile dysfunction? Briefly, sir.
Okay, so erectile dysfunction is inability to initiate and sustain penile erection enough for satisfactory sexual intercourse. This individual cannot get his penis up hard enough to penetrate, or when he does, he cannot sustain it within a minute. Within trying to put it into the vagina in a few minutes, is down. And it's not related to ejaculating. He doesn't have to ejaculate. Premature ejaculation, on the other hand, means the person has normal erection. The penis is turgid, is erect, but before penetrating, either during foreplay or something, or just after penetrating, in less than 1 minute, the person ejaculates or releases, and that's the end. So they are very different, but they are all forms of male sexual dysfunction.
Someone is asking us, he says, please, doc, is there any pharmacological cure for premature ejaculation?
Yeah, just like we said, it's a combination, behavioral therapy and pharmacological. I usually start with the behavioral therapy, the changes and the techniques on how to prolong sex. And then there are also drugs that we can give if the patient is not doing so well on only the natural way. So there are various agents that have been tried. So many number of drugs that have been tried for this kind of people with significant success. So once you meet your urologist, they start you on all the various types of treatment from behavioral, and if you need to take drugs, they give you drugs. Why I don't start with the drugs is that how long do you want to be taking drugs? For how long, and not to mention that drugs also come with their side effects. So are these side effects you want to have, for the rest of your life? And then the other thing I was saying is that, apart from that, some of these drugs also, patients also develop some form of tolerance to the drugs. So by the time you give someone a drug and he takes it for a couple of weeks, sometimes the effect of the drug wears out and they can't, it doesn't have the effect anymore. So this is why the pharmacological therapy I leave as the second line after you've tried all the natural behavioral techniques and mechanisms.
Someone is asking us on Instagram, says, doctor, for how long should a good sex last?
Okay, so I've said this before, you'll hear it then. Studies have shown that the normal latency period in men is between 5 to 7 minutes. This is what when populations were studied, about 70% of men had a latency period of between 5 to 7 minutes. This is the period between which they have the erection, penetration, before ejaculation. All right, it can be longer, okay, and it can be shorter. And don't forget that the time duration that we use for premature ejaculation is ejaculation before penetration or within 1 minute of penetration. You understand? So, as we said, premature ejaculation also entails inability to delay ejaculation. So what this means is that your 3 or 4 minutes may not be satisfactory to your partner, and that each couple should work out what works for them. If you want to last 10 minutes or 15 minutes, if that's what makes your partner, tick, or what makes her happy, then you should be able to try to delay your ejaculation up until that. We're not saying you should kill yourself, Baba. Don't kill yourself. This life is just one we come. But there are ways to try to prolong it as much as possible to the satisfaction of both yourself and your partner.
Now we have one question here, I think 2 questions. So someone is asking us, not related to the topic, but it says that what is the cure of erectile dysfunction?
The cure of erectile dysfunction.
That's not what we're talking about.
That's what we're talking about. But erectile dysfunction can be cured as well. Since we know what causes it, there are. Let me give you a summary. Erectile dysfunction can be psychogenic, can be organic, or can be combined. Psychogenic means that nothing is wrong with you because of stress, because of some issues that you can't handle at the point in time. It just makes you unable to have a good erection. My guy, they get a time shapa, we will catch you. Erection will just go. There are a lot of stressful concerns. So that's psychogenic. We know that when you remove some of those issues, the person functions well. It can even be related to your partner. When the person goes to another partner, he has good erection, but with this partner, it just doesn't work. So these are all psychogenic, right? And then there's organic. Organic means that there is a health condition that you have, and there are over 1,000 health conditions, from diabetes to hypertension to all sorts of things. Anything that affects the blood vessels that supply blood to the penis, anything that affects the nerves that supply the penis and gives you sensation, any health condition is only a body that is healthy that can have good erections. So you have chronic diseases like kidney, liver, anything like that. All right. So the treatment for erectile dysfunction is not a one-shoe-size-fits-all. It will all depend on what type you have, what is the cause, and then we treat it, and then you have your erections back. So it can range from lifestyle changes to drugs. It can even go to surgery. But what I can assure you that there is always a form of treatment that is suitable for any man. Sickle cell disease in our environment is a common cause of erectile dysfunction. All right, so it's just a different topic altogether, and we don't want to digress because that will be taking us away from what we are discussing, which is premature ejaculation.
Now we have a question here. I think you mentioned it before, but let's take it again. It says, Doctor, please, can someone's lifestyle and the type of food he eats cause or cure premature ejaculation?
Yes, so cause, just like we mentioned, yes, there are certain things that can cause it. We talked about excessive smoking of illicit drugs, excessive alcohol ingestion, lack of exercise, obesity, and all those kind of things. So all these are things that can cause. While the cure, or the form of things that you can do to cure, will include reversing those things. Fitness, exercise, eating healthy in terms of a lot of fruits and vegetables. And when you eat healthy, when you're trim, when you're fit, it goes a long way in also improving the quality of your erections, and with help you can have longer sexual experience, and premature ejaculation will not be the kind of thing that you have. So fitness, good diet, also very important.
This one again is saying, how do one delay ejaculation? Okay, let me try to break it down a little bit extra. Let me expand it. So let's say a young man has no problem, but he wants to delay his ejaculation. Are there tips? What can he do to at least help him delay his ejaculation?
Yeah, no, there are different techniques. You just give us a consult, just give us a chart, and then we can talk. Give you step by step on ways you can do to prolong your sexual experience. It's something that we've done for so many different people, and it will improve you to at least get you up from where you are to a much better level. And the fact is that if you're consistent with this behavioral modification, behavioral techniques, you can be as good as you want and as good as your partner, at least be enough to satisfy your partner with ease, and all that. And you're able to let your partner, your woman, achieve orgasm as many times as you want before you climax. So this is the reason why it's an important thing to discuss.
Someone is asking us, does sugar intake cause premature ejaculation?
Yeah, well, we hear this all the time and all that. Not really. Sugar intake, when we talk about sugar intake, we are talking about, does it cause diabetes? The idea is that if you are a healthy person, no matter the amount of sugar you take, the pancreas should be able to produce as much insulin to neutralize that sugar, right? So you're unable to handle your sugar when there are already some issues in your body which may affect this. Okay, so it's not about sugar intake and no sugar intake. Of course, we have what we call a healthy diet. If you listen to us on our health talk, we talk about a healthy diet. A healthy diet means that we do not encourage you to take this high sugar content stuff, especially the industrialized ones, Coke, Fanta. They have lots of sugar already made in a form that is easy to absorb. As you drink it inside your tummy, you start absorbing it from the small bowels. The natural food that you eat, like rice, like pounded yam and all those things, those are usually slow release. The way God has made them naturally, slow release of carbohydrates into the circulation. So this high sugar content stuff are things that we discourage generally, apart from generally for your health. And don't forget, your erectile function and your ejaculation are also a mirror image of your health. If you're healthy enough, usually you don't have this condition. So I strongly discourage you from high sugar intake for various reasons, because it's just not healthy for you.
Finally, as Dr. Martins will be rounding up, he says, a friend of mine told me that I can prevent it by masturbating 30 minutes before meeting my partner. How true is this?
Well, to be honest, yes, that's actually something that has been studied. Because if you realize from what I said earlier, one of the pathophysiology of premature ejaculation is hypersensitivity, overexcitement, okay, from the nerve stimulation on the corona, which is the glans penis, right? So it's been found that, you know, things like use of condoms or, you know, anything that can numb the penis can actually improve or increase, you know, the latency period or the period before ejaculation, right? So if you notice as well, after the first round of sex, the sensitivity of the penis is slightly reduced after the first round of sex. So this is what was targeted in people who studied, you know, masturbation, you know, before, you know, sexual intercourse, because we found that after the masturbation, which is the initial time, the initial first round, when the person is very sensitive, by the second time, which is now when he's having intercourse, the sensitivity is reduced remarkably and can give the person a longer latency period. So actually, your friend was actually quite correct. However, this does not always work, because for people who may have suboptimal erectile function, after that initial time, he may find it very difficult to achieve another erection for the sexual intercourse, the sexual experience that he was working towards. So you can. I think it's important also for young people to know that there is not one single, you know, way to solve this. This is why there are various techniques that work person by person, and then find out what actually works for this for the individual, and then use it.
So I'll just give Dr. Martins the floor again, so that he can give us a brief recap as we round up.
Okay. So for the people that are here, thank you for joining this live. It's actually always a pleasure to talk to our people and try and educate them as much as possible. So in summary, we've spoken today about premature ejaculation, which was defined by the International Society of Sexual Medicine as ejaculation which occurs before penetration or within 1 minute of penetration. It also entails inability to delay ejaculation, and the consequences are depression, loss of confidence, and even suicidal tendencies. So you can see there are 3 components of this definition. So we also said that the normal latency period for a man, normal time between having an erection, penetrating, and before ejaculation is usually between 5 to 7 minutes in about 70% of the population. So this is why when it's a lot shorter than that, then we are talking about premature ejaculation. But we must also note that this time is not cast in stone. It's also dependent on the partners or the couple in question. Some couples, a partner may not also be satisfied with 3 or 4 minutes, and they may want a longer period. So this is why the male must be able to delay ejaculation as much as possible. You know, great. So we spoke about the fact that this is something that is very common, because about 20 to 30% of males in the population, and it affects all age groups. And there are different types of it. There can be the primary type, which occurs in young men from their first sexual experience. All the time it happens. It can be secondary, where a man has normal sexual experience, then